A lot of updates, of course, this week about COVID-19, vaccine related. We'll get into all that stuff. But first, let's start, as we often do, with the numbers from Johns Hopkins University. Now, more than 82 million diagnosed cases of coronavirus around the world, at least 19.5 million of those here in the U.S. The country mourns now more than 338,000 American lives lost. The CDC, get this, saying we have now surpassed 50% of the total deaths from that raging influenza pandemic from back in 1918. Sobering numbers there, Doc. Hope on the horizon. Vaccines are going out, but the pace, 2 weeks, 2 million vaccinated. That is not good. No,
not good. We have to step on the gas a little bit.
We need to pick up that pace. But meanwhile, it never fails, right? Somebody trying to find a way to take advantage. So we have vaccine scams we need to keep an eye on.
Exactly, and we've talked about it here on the show before, TJ, and the FBI reminding people to be on the lookout. So here are some red flags that people do need to be aware of. If you hear an advertisement for a center, a doctor's office, anyone charging you a fee for a COVID-19 vaccine, that should raise a red flag. Right now, they are not available at doctors' offices or small clinics yet. Down the road, they will be, but that should be another red flag. And again, the risks here, if people are selling or promoting the administration of possibly counterfeit products or products that have been diverted from other big centers. It could be a sham liquid, possibly it could be a toxic liquid, and again, it is being diverted from prioritized groups. And the consequences, we've seen an example here in New York State with Governor Cuomo saying that he will crack down with at least $1 million in possible fines, possible loss of licenses if you're talking about doctors' offices or health clinics, and possibly criminal charges. So this is serious stuff.
And you mentioned there, Doc, prioritized groups. So who's next in the order here of getting a vaccine?
Well, we heard the CDC recommendations that healthcare workers and residents at long-term care facilities go first. Then in Group 1B, you're seeing certain essential workers, people who work in education, first responders, for example, adults 75 years of age and older. And then Group 1C will be adults 65 years of age and older or adults with a chronic pre-existing medical condition. We still are figuring out whether that's going to be done on a small level, a micro local level, or whether the CDC is going to say officially now go to 1B, go to 1C. We're still working out those logistics.
All right, Dr. Ashton, thank you as always.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.